Hey folks, my name is Dr. Amy Pearlman. I am your host for Pearls and Perspectives, and I am a board certified urologist. And we have Jeff here with us today. Jeff, say hello to the crew.
Hey everybody, I'm Jeff Myers. I'm an emergency physician transitioning into sexual medicine.
I love that.
Yes.
Yeah. And we have briefly communicated on LinkedIn, and then we ran into each other at the Stimulate trade show in Nashville, Tennessee. And it's so interesting and fascinating, and I absolutely love it that you're an ER physician transitioning into sexual medicine. Tell me more.
So yeah, you'd be surprised. There's actually a lot of sexual health that goes on in the emergency department, and not just STIs.
Yeah.
I've been practicing as an emergency physician for about 25 years now, and over the years, I would get questions from patients on just a whole variety of different things, including some that I would send to surgery or were had some major treatment coming up on how is this going to affect you know things with my partner. So a couple of years ago, I wanted to learn more, so I got involved with the Sexual Health Alliance and their sexuality counseling and education program. And then that kind of just said, hey, this is really enjoyable and a different way to help people. So looking at that as kind of a career transition. So I started that about a year and a half ago, starting to try to build towards that end goal.
It's so interesting because I would imagine that most people, when they're meeting you in an emergency room, they're not in a good place.
No, definitely not.
And so you're kind of going from a place, I mean, like in the sexual medicine space, I was talking to someone last night. I was like, I don't know why more people don't do what I do. Like when people walk out the door, there's like a pep in their step. Like they're oftentimes, I mean, my goal at least is for them to look forward to seeing their urologist, right?
Yep.
So you're kind of going from two ranges
extremes.
of this, two extremes here, right?
Yes.
What does that mean for you?
Oh,
so was this coming out of a place of like burnout, or you're like, wait a second, I'm looking for something, I want to change in my career?
So it's a little bit of both.
Yeah.
It's a little bit of both. I mean, certainly the emergency department is very hectic. I worked at level 1 trauma center, tertiary care centers. I worked in very rural community hospitals. So just the wide gamut of things that I've seen over the career. Some of which is not that great. But it's an honor and a privilege to be able to help people in that way. But as I kind of went through and progressed, I wanted to do a little bit more and maybe help a little bit more on the long term, not so much in the negative situations, but in kind of the pleasure situations.
Yeah.
And
because the only patients that you're seeing for long-term care in the ER are patients who have nowhere else to go.
Right, exactly.
So it's never a good circumstance when you're like, oh, hey, Bill, it's good to see you again.
Right.
Yeah.
Very few circumstances like that. Yeah, and some of this also comes from my own experience and to kind of share my first wife passed away of cancer. Had a major surgery, major treatment throughout that time, and nobody ever, this was in the late 90s, nobody ever addressed our pleasure as a relatively young, I mean, we were young, but relatively new, newlywed couple. And so that ended up lasting, even though the treatment finished, or the first round of treatment finished, that lasted for a couple years until we actually found someone who could kind of help out with what was going on. So kind of drawing on that experience. And so a lot of the people that I want to work with are kind of in those transitions. They're transitioning through midlife, or they're transitioning into older adulthood, or maybe someone is having a major surgery, or they had a major injury and they want to kind of reclaim that. That's an important part of them, important part of who they are. And so I'd like to help kind of guide them in that journey.
Yeah, I love that. Okay, so I'm going to pretend like I'm one of your critics here for a second. Is that okay?
Go for it.
All right. So if someone says, well, I mean, does it really make sense for an ER physician to go into sexual medicine? I mean, what does an ER doc know about sexual medicine anyway? What would you say?
Very nice. I love it.
Jeff, I would never actually say that. You know that.
No, but I love that. I love that. No, actually, that was the nice thing when we had our conversation over LinkedIn. You were very approachable and accommodating, because I've heard some of that. Like, some people are like, oh, that's really cool. That's very interesting. Yeah, we need more of that. And other people are like, what the heck are you talking about? But no, actually, I kind of draw on my experience as an emergency physician, taking the broad view of everything. And then also as an osteopathic physician, I take that more holistic view. So let's look at the whole person holistic. Because a lot of people come and they have a perceived issue. This is my issue. This is what I'm concerned about. Well, we've got to troubleshoot that. And, as physicians, we need to troubleshoot that. Is there a physiologic thing that's going on? Is there a behavioral health thing that's going on? Is there a sleep thing that's going on? Is there a nutrition thing that's going on? What's going on in this person's life? And that's, it's not usually just one thing. It's usually, 5 to 10 different things. And okay, what's going to be most important? How do we tackle this? What's your end goal and how do we get you there?
Yeah.
So, that's kind of what I do as an emergency physician. I have someone come in, let's say they're having chest pain or abdominal pain, and they look like crap. I need to figure out what's going on with them, and that may take a lot of different testing. That may take a lot of different thought processes. I may need to involve a lot of different specialists. So it's kind of a very similar approach,
Yeah.
that differential diagnosis, so to speak, and what's going on.
Absolutely. And the reality is sexual medicine lives in every single specialty.
Yes.
And you're seeing, people coming in with, cardiovascular disease. And oftentimes the sexual functioning or the dysfunction was maybe like the first sign,
The canary in the coal mine.
before they hit with a heart attack.
Yep.
So it seems like you're trying to reach them maybe earlier, right? But also even the people that are coming in with these devastating life events in terms of their health, still understanding sexual health still matters to a lot of these people.
Yes.
I love that. I think sexual health absolutely belongs in emergency medicine.
Yes.
And I love what you're doing.
Yes. I really would love, my hope is to partner with other physicians in the area. And then as I build a network, so that if, let's say as a urologist, you have someone who's, going through a radical prostatectomy, that you go, hey, I know this guy. I want you to see him and talk to him about this beforehand, because as someone who is working in the medical system, most doctors just don't have the time to sit down and address that whole issue. We get blamed for things, but we just don't have the time to really get that in depth. So that's why I want to try to offload that and be that adjunct. So, let's say you are doing a radical prostatectomy on somebody. Okay, here, I'm your sidecar. We work together as a team to try to help, maintain that goal.
Yeah.
For that client, for their partners, so they can enjoy life.
Yeah. Well, I'm looking forward to this transition in your career. I think this is awesome. And you're kind of going from a place where you're trying to rule out all the bad stuff that's going to kill someone to a place of like, how can I help this person thrive and have the best sex of their lives?
Yes, exactly.
What a beautiful transition.
I love it. I'm going to use it as a tagline, I think.
Jeff, always good to see you. And
yes,
thank you so much for joining us today on the pod.
Thank you. I appreciate it. Great to see you.